It's my pleasure to welcome you to this advocacy event, Beating Liver Cancer in Europe, the empowerment of prevention and early detection under the patronage of the Slovenian presidency of the Council of the European Union, organized by the European Association for the Study of the Liver, EASL, together with the European Liver Patient Association, ELPA. My name is Thomas Berg. I'm the EASL Secretary General, and I would like to thank you, the Slovenian government, for supporting us in the organization of this event during the presidency of the Council of the European Union, but also all organizations in Slovenia who support us, which are, among others, the Medical Faculty University of Ljubljana, Slovenian Association for Gastroenterology and Hepatology, Slovenian Patient Association with people with hepatitis, Cancer Patient Association of Slovenia, and also the WHO country office in Slovenia. While we are here today, liver cancer numbers are on the rise, but public awareness for it appears to be lower than for other cancers, probably as a result of the stigma attaching to patients with liver disease. We need to act urgently to change this scenario, to detect and treat liver cancer early, or even better, to prevent this disease and prevent patients from suffering from liver cancer. It cannot be overestimated how important it is for patients with liver cancer in Europe and the groups that support them to receive the attention they deserve, not only from healthcare professionals, but also from our policy makers. So thank you all for being here today, all together around the table. We are grateful and thankful to all those who have contributed to making this event happen, especially to the representatives of the European institutions and the Slovenian government who are present to hear our concerns related to liver cancer trends in Europe. I hope this event will be the start of the beginning towards a new era of cancer prevention in European patients with liver disease. So over to the president of ELPA. Over to you, Marco.
Thank you very much, Professor Berg. It's a privilege and an honor to be part of this event. I do want to stress that thanks to all the people who are involved in organizing this event. Facing liver cancer diagnosis is never easy. And with this event today, we want to show and together with the decision makers discuss what would be the best appropriate way for European Union to move forward. In regards of the Slovenian government, I would express my deepest thanks and acknowledgement that this issue will be high on the agenda. If you are a liver cancer patient and you live in different parts of Europe, you receive also different possibilities how to be part of the healthcare system. So all this will be shown today, and I'm honored to be part of such a high-level panel from representatives that are making a decision. Usually we say it is good to send a message to the stakeholders who are the decision makers, but today I'm proud that we have the decision makers at the table. So we are sending a clear message not to the stakeholders, but we are together with them deciding what is the best course of action to take in the future. This will be beneficial for liver cancer patients. This will be also beneficial for all people who are facing liver diseases in European Union. So thank you all, and I'm looking forward to the clear discussion about the presented data on how is the position of liver cancer today in European Union. And we made an effort to bring in patient representatives from different parts of European Union just to show what can you expect if you are a liver cancer patient. And at the end of this welcome remarks, I would stress that EASL is one of the few, or maybe only one, organization of doctors and medical researchers in the field of liver that has involved patients from the beginning. So ELPA is here for 16 years, and EASL and ELPA collaboration has gone on for the last 16 years. So thank you very much for involving patients also in the decisions and discussions about how to proceed. Without further ado, I would go into the opening remarks. So it's a distinguished honor to invite Slovenian politicians to do the welcoming remarks. We should remember that this event is organized under the presidency of the Slovenian to the Council of European Union. And in that frame, we are sending a message that liver cancer patients are important, and the liver cancer patients do need additional steps that are needed to take in order to improve the position of liver cancer in Europe. So for the opening remarks, I'm welcoming Igor Zorčić. He's the president of the National Assembly of Republic of Slovenia. Mr. Zorčić, please, for the opening remarks. Thank you.
Commissioner Kyriakides, Minister Poklukar, distinguished representatives of the organizers, ladies and gentlemen. It's an honor for me to be able to welcome today the best national and European liver cancer experts. Following the outbreak of the pandemic, national health systems have found themselves in truly trying circumstances. Therefore, warnings from health professionals, namely that cancer doesn't rest, should not go unheeded. I especially welcome the initiative of the Ministry of Health to sponsor this high-level event during the Slovenian presidency of the Council of the European Union, helping make sure the goals of Europe's Beating Cancer Plan are boldly implemented. While the decrease in mortality from some cancers over the past years, mainly thanks to advances in medicine and pharmacy, vaccines, effective screening programs, and increased public awareness is undoubtedly a cause for celebration, it is nevertheless extremely worrying that fewer malignancies were detected during the pandemic. This could result in malignancies being detected at an advanced stage when treatment and rehabilitation are more demanding and expensive, and the end resultant uncertain. Liver cancer is no different. Professionals warn us of an impending new pandemic, that of liver cancer. Luckily, most hepatic diseases are preventable. Today's event can therefore also serve as an opportunity to send a message to lawmakers. Properly regulated marketing of sugary food items, hidden trans fatty acids, and alcohol could contribute to greater awareness of risk factors such as obesity and type 2 diabetes. I also believe that Slovenia will set a good example for the European Union as a whole by carrying out targeted screening for liver cancer. I'm confident that today's webinar will lay a solid foundation for the successful implementation of Europe's Beating Cancer Plan. Thank you.
Thank you very much. And now it's my pleasure and privilege to welcome and to introduce Mr. Janez Poklukar. He's a Minister of Health of the Republic of Slovenia, and to invite him for his opening remarks.
Dear esteemed guests, I'm delighted to welcome you at this important meeting on action for prevention and early detection of liver cancer. Slovenia placed cancer on the EU agenda in 2008, and I'm pleased that the European Commission adopted ambitious Europe's Beating Cancer Plan. It is time now to focus on the implementation. Liver diseases are the second leading cause of premature death in people of working age in Europe. Also, most liver diseases are preventable. They often lead to the development of liver cancer. It's the sixth most common cancer and the third leading cause of cancer death. Over the last decades, the incidence of hepatocellular carcinoma, which is the most common liver cancer, has continued to increase. Figures clearly show that we must tackle the main risk factors for liver cancer more efficiently. We know that reducing harmful alcohol consumption is the most powerful strategy to prevent new liver cancers. In some countries, which including Slovenia, alcohol is the most important risk factor, and we are struggling defining consistent alcohol policy to address this issue. We must also continue to tackle obesity and type 2 diabetes through limiting marketing and promotion of sugary food items. In addition, we must ensure access to hepatitis B vaccination and enabling treatments for hepatitis C and B to prevent liver cancer associated with both viral infections. Aside all these strategies, we should look at the evidence if the already existing target cancer screening should be extended. I'm looking forward to the European Commission proposal for an update of the Council recommendation on cancer screening, which will address this topic. Slovenia is preparing the third national cancer plan, which is in line with EU Beating Cancer Plan. We put a lot of attention to primary and secondary prevention. Prevent the preventable is our motto. We successfully manage viral hepatitis with the aim to its elimination that serve as one of the WHO best practices examples and will be presented at this meeting. Besides, Slovenia is also well recognized for its commitment to tackle health inequalities, especially by reinforcing the links between the Western Balkans. I would like to thank the organizers for raising awareness of the importance of chronic liver disease prevention and prevention of liver cancer. Slovenia stands ready for sharing good practices and collaboration in the future. Thank you for attention.